Hey there, all. Thank you all for tuning in today on a very, very special episode with two guests for the first time ever, and also female guests, actually, for some weird reason. I got reminded the other day that I've only ever had guys on the show. So this is the first time that we're breaking barriers. And I am so happy to welcome the team from Rodericks Dental Group. And I've got two people, as I said. One is Gemma and one is Puja. I'm going to hand it over to them to do a quick introduction as to what their roles are within the business. And then we're going to kind of go into a bit more of a deeper dive as to how they can help us aspiring dentists and those that are actually qualified abroad as well. So, guys, over to you if you're going to give yourselves a minute each, let's say, just to give a brief introduction to yourselves.
I'm Gemma. I've worked with Rodericks Dental Partners for the last 5 years now. Have been doing international recruitment for the last two years. So currently I'm the lead recruitment specialist for our international dentists. So work closely with the girls in my team. So we've got Carolina and Steph who look after North and South areas, and just kind of helping support you lot find positions in the UK, really.
Amazing.
Lovely. Hi everyone, my name's Puja. I'm a dentist. I've been a dentist for 20 years. I have been working with Rodericks Dental Partners for 15 years. I have a special interest in endodontics. I'm also one of the clinical advisors, so I go out and meet our dentists. We're here to support, develop them, and I also work very closely with our international dental graduates, overseas hygiene and therapists, as well as our dentists on our nursing pathway.
Amazing stuff. And we're definitely going to be discussing the nursing pathway and how both of you guys can help with international dentists, because that's a huge amount of the people that I actually interact with. So a lot of the messages that I get on my social media are from people abroad, be it that they're actually British like myself, but have studied elsewhere and now want to come back home, or be it those that are, say, for example, I get quite a lot of messages from people in India and Pakistan, people in Africa that want to actually practice in the UK, but just have no idea on how to do it. So let's kind of get into that straight away off the bat. The first thing I think that people really want to know is, we hear all these stories that dentistry is highly competitive and they don't know whether or not they're going to be able to find a job. People that want to go into this career path are always worried, is it going to be something that I'm going to end up finding a job with? So in the first instance, can we put that myth to bed? Is there any evidence behind the amount of work that might actually be out there?
I mean, I believe that if you are a dentist and you want to work in the UK, there is going to be something for you. There are so many opportunities. There are so many avenues. We provide lots of opportunities for dentists that have come across from different pathways, that have got different interests. There is something for everyone, and there is a shortage of dentists in the country. So you won't be short of a job for sure.
Perfect. Gemma, anything to add to that?
Yeah, no, 100%. I think my main thing from a recruitment element is if you want to be in the big cities like Manchester, London, they're very, very difficult, for the first kind of year if you're looking obviously to get your NHS performer number, and obviously work alongside a mentor. So, we always say put your kind of views a little bit kind of further afield, look at the outskirts initially. You're just starting your career. Actually, once you finish that kind of first year, looking at kind of those city options tends to be a little bit easier after that. But yeah, definitely not kind of hard to find some positions.
Brilliant. I think that is one of the key points there. I think we always think about just the big cities, especially those from abroad, always thinking about the Londons and the Manchesters, for example. So kind of manage your expectations. But then when we think about the outskirts, as we could probably call them geographically speaking, what are some example locations of those, and kind of, is it easy enough to then, working through Rodericks, find work within those, especially in those early years?
Yeah, definitely. So, I mean, if you look in kind of like the London area, we go down to like Guildford area, and then you've got the outskirts in terms of like your Slough, Luton, Bedford, Northampton. So that's looking at your south. If you're looking kind of from the Manchester We go a little bit further down into like Stoke-on-Trent. You've got Nottingham, Derby, Leeds area and everything as well. We've got a range of kind of available practices and positions there as well.
Great stuff. And then just to kind of understand how the recruitment process works in itself, what are you looking for? What are these clinics looking for, and the teams within them in terms of candidates? And then what is it that you guys offer these candidates? I mean, obviously the candidates need to come in, they need to understand how to actually practice dentistry within the UK, or obviously they're doing their foundation year. Break down the differences between foundation year and then you guys recruiting for associate dentists in general, and then kind of what you're looking for.
I mean, so I know Puja can break down obviously the difference between FD and obviously coming in as a mentor. Sure. But in terms of what our practices are looking for, it varies. Obviously, if you're looking to do your NHS performer number, all of our mentors are very, very different. We like to give the autonomy to our mentors and our international dentists coming through, you know, to pick that working relationship that's going to work for them best for the next year. We will have mentors that would prefer people with, you know, 10 years experience or something coming, you know, from places like India, Pakistan, who have got that experience there already. Or, you know, we have mentors who are more than obviously happy, you know, for our new graduates that come on. And we know that depending on where you've studied from, that level of hands-on experience and everything as well that you get is very, very different.
Yeah.
Times are massively changing though, and I think we've worked really well with our mentors in terms of actually there isn't a lot of difference between those who have got, you know, 10 years experience and those who are, you know, just coming out of university. We've got a really good structure and support in place from the clinical element that ultimately supports all of our mentors kind of out in practice. I think as you go into a practice, when you meet your mentor with the you know, you're there, you're willing to learn, you don't come in that, you know everything or anything like that, then you're obviously going to really, really work with our mentors.
Brilliant stuff. Puja, anything you wanted to say to that bit?
Yeah, definitely. So obviously following on from that, Gemma has outlined our support structure. So we have dentists who are foundation dentists. Obviously they have an ES, an educational supervisor, to support them in those years. Similarly with our mentees, we have a mentor. We then offer them an FD +1 scheme as well as an overseas +1 scheme. So those schemes are an extension of that first year's learning. In the first year learning as an overseas dentist, as a mentee, we provide a 3-day clinical induction where we talk through our own bespoke clinical passport of how that is going to help them in practice in order to get their performer number. So it's very comprehensive. The whole clinical team are there. There's a lot of hands-on elements. So we're providing support in those early days, which is really crucial. The clinical team are on hand to support and provide the CPD. We run webinars, we host peer reviews and peer events, and so that we have got close contact with our dentists throughout the year. And obviously, if you have a special interest as a dentist, we provide something called co-funding, where the company pays up to 50% of course fees.
Wow.
That's applicable after the 3rd year of being with us. Yep. So a lot of people take advantage of that. And it's an avenue for you to develop those skills. And we also help provide a referral-based system. So if you have a special interest, we can work with our sister practices to get patients referred to you. So we have a very good collaboration within all of the practices, and we all support each other.
And when you say all of the practices, how many? What are we talking about in terms of numbers? Because you guys are huge, right? And in a good way.
Yeah, we've got over 225 practices now.
Jeez, wow! It's going in that direction. It's going up, which is
going up.
I mean, just kind of yeah, in the right direction. Just to give some context to anybody else listening out there, there's obviously the UK. There are many different groups or people. I don't like to use the word corporate, but people do use that term around of ownership when it comes to clinics. But one reason that I've got Rodericks on is because I've heard nothing but good news from them. I mean, we were speaking offline, Gemma and myself. We still feel as though we've once had a chat a long time ago. So that's how good they are, that even somewhere in the past we've had a discussion. I've had a guest on recently, podcast comes soon live. His name was Dr. Mudassar Hussain. He's a locum with you guys, and
Oh,
he,
yes.
yeah, so all right. So there you go. So just the bell's been ringing there, and he was saying to make sure to mention him because he's got nothing but good stuff to say about you guys, and he wanted that to be publicly announced. And then obviously we're going to be coming on to a student that reached out to me recently about a post that I left about Georgian universities. And now he's gone on to do some amazing things through you guys as well. So just for those people out there that are trying to understand how does kind of the UK work and where Rodericks fits into it, this is a bit of a background there. So that's amazing stuff. I think one of the questions as well that I typically get is within that foundation year, what do dentists need and why is a foundation year important? Why can't people just come in and become private dentists? Because according to the law, they're allowed to do that, right? So in your professional experience, what's the benefit of doing a foundation year and what's included in that foundation year? What's expected of dentists?
So the foundation year is critical. Obviously, as a fifth year dental student, you pass your exams and you then become registered with the GDC. I think I won't go too far back, but after COVID, there are lots of cohorts of dentists that qualified that probably didn't get a lot of experience clinically. Yeah. So it's crucial from that perspective that you have a mentor. And in order to obtain a performer number, you have to carry out your FD training. It's quite a detailed criteria of how many procedures you have to do.
Right.
It's almost a stepping stone for you to lean on your educational supervisor to develop those skills, increase your confidence, learn further with regards to communication. And by the time that those 12 months are over, you're ready to practice almost independently. So it's definitely a stepping stone and critical. And kind of thinking back to my own experience 20 years ago, it's probably one of the most important years of my career.
Amazing stuff. So it's the thing, as you said, the performer number, which then allows you to not only gain that experience of all the routines within it, but also then to work with the NHS, which is massively important, right? So is there anything in terms of like figures that maybe we can discuss regarding split, let's say, between private and NHS work within Rodericks as a whole, or is that kind of way too varied?
I mean, it does vary, and the way we present it is all patients should be offered all options.
Yeah,
and I think that does vary down to the clinician and what patients they are seeing. But the private sector is an ever-growing sector, and with Roderick supporting the development of clinicians, people are able to provide a lot more options that patients want and should be given.
I'm with you. And obviously, when it comes to NHS work, obviously having that performer number is very important. The way that the NHS is kind of understood, or the way that we kind of, track it, let's say, is through UDAs, right? So units of dental activity. So now we're talking about contracts here, right? So we're coming into that because obviously UDAs, a lot of people when they go in for a dental contract, I had one fella actually reach out to me and said, I've got a contract here from a place in Brighton. It wasn't with you guys. And they're offering me X amount per UDA, but I have to do so many UDAs in the year. I'm a bit worried whether I can handle it or not. What does a typical contract look like when it comes to rates of UDAs and the amounts of UDAs for a first year or foundation dentist in the world of Rodericks?
Yeah, so we probably do things slightly differently to other companies or independents in a respect that we have two contracts. So for those that need a visa to obviously come and work in the UK, what we would do is put them on an employed contract so they get like their guaranteed salary. The reason we do that, and we know people can go elsewhere for it, the only reason we do that is because the Home Office obviously stipulate they have to have a minimum income. And for us to guarantee that in the best way is to put them on an employed contract, which obviously comes with its different benefits as well, obviously being self-employed. But if we're going down that typical, self-employed route, if you're working 5 days a week, we give a UDA target of 4,500 UDAs. Now that is reduced from what you'd expect kind of an FD +1 to deliver, which normally is around 5,000 to 6,000 UDAs in their first year.
Right.
Depending on location and practice, our UDA rates start at about £11 per UDA. Yeah. Obviously, everything's very negotiable depending on practice, but they start about £11. And what we say in our self-employed contracts is when you start your NHS, you are paid for what you deliver. So if you get towards the end of that financial year and you are behind on your target, we won't, give any financial implications or anything like that. The reason for that is because we don't want to put the pressure for the first year. Yes, obviously the NHS and you delivering that NHS contract is important, but we want to make sure that you're getting enough time to see the patients and doing obviously those treatments correctly, rather than patients coming back, for any treatment that's gone wrong or anything like that in the long run.
Great stuff. And then obviously you mentioned there as well, and again a very important point about visas, right? So how when we now talk about the overseas dentists that are very interested in this subject matter, what could they expect? Is it clear cut, or is it very much a case of case by case basis if they wanted to come over and work through Rodericks? Do you encourage people to apply, or is it very much these are the criteria before you even think about it and then get in touch?
No, definitely encourage people to apply. Obviously, as long as you have the ability to register with the GDC. So if obviously you're from an EU country where your degree is not taught in English, you're going to need to do the IELTS exam before we can even progress to any kind of stage.
Yeah.
What we say though is that you don't need to wait for your GDC registration to come through. We can look at practices, look at options from the get-go, and then we'll wait for the GDC number to come through and we'll tailor your obviously start date towards that. A lot of what we do is when we're going out to different countries is off the back of that, we'll try and get people, to look at practice and sign contracts then. So that could be starting from, January, whereas you might not start until the September, October time.
Yeah.
But it's always nice to know that potentially you've got that practice and, what's going to happen as soon as you graduate.
That's amazing stuff. I mean, the fact that people could have the opportunity to do this through you guys and you're experts in the field, I think it just puts a lot of people's minds at ease, which is very nice to know. I think kind of coupling off of that, now sticking with the overseas dentists, maybe this might not be a Rodericks question, but I know you guys are very well established with the likes of the GDC and the BDA, and you know them all very well. What's your thoughts on the ORE? I mean, there's whispers always flying around. They're looking to get rid of it, or they're looking to change it. There's currently an extension on EU exemptions until 2028. There's words about that just being indefinitely extended as well. In your opinion, just maybe it's your personal opinion, not a Rodericks opinion, what would you say the future of the ORE looks like for overseas dentists?
I think obviously, they are looking to make it easier for overseas clinicians to come and work in the UK. And my personal opinion is I think there needs to be some form of formal assessment.
Yeah.
So I guess we will have to wait and see how quickly this comes through. But I think definitely it should be easier and quicker for people to get onto the GDC register.
Right.
But at the same time, still have a formal assessment.
So there'll always probably be something. I'm with you, yeah. But then that's obviously, again, bringing it back to Rodericks. I don't want to just keep making this a massive plug, but it really is. You guys are at the sort of the front lines of everything when it comes to dentistry in the UK. So kind of having a close relationship with you guys, and I would urge anybody listening, even if you're in the position where I am, which is studying instead at uni, get in touch with them because they've helped me. And if anything, I've kind of reached out to them because of their interactions and our communication. So definitely get in touch. They're a wealth of knowledge. And again, one thing that I've recently come across now, because, I'll always have people asking, I'm a dentist. I've been a dentist for 5 or 6 years. I know everything about dentistry. I probably know more than you guys in the UK, but I can't get in, or I want to sit the ORE, but it costs a lot of money and I'd like to earn something while I'm waiting for it. So many different scenarios that you've probably heard yourself before, right? Recently, I've come across a fella over on Instagram, as I messaged that, as I mentioned, that finished his degree over in Georgia. He's British. And he's actually come through a program that you guys have set up, which is remarkable. And I really want to give some airtime to that. Recently, I know that the GDC changed their tact on allowing overseas dentists to register as just nurses or therapists off the bat, right? Because they used to be able to do that. You used to just come in, register as a therapist, and they'd pretty much sit there and earn a lot of money and then do ORE whenever they felt like it. They've kind of, shackled that down a bit. Now we're moving into a phase where people are either dentists but they become dentists, or they're nurses and they become nurses, and that's it. You guys, however, have figured it out, right? So let me leave it to you to share this news to the listeners of how they can actually take advantage of being more than just a dentist within the UK while they're studying for the ORE and making money at the same time.
Yeah, so we have developed a great program where you can enter our international dental nursing pathway. So you are allocated a practice. You are then you will do a fast track dental nursing course. Register as a dental nurse. You will be paid obviously for working, and at the same time you can be preparing for your ORE. It's a really invaluable opportunity because you get to know firsthand how UK practices run. You get to observe a clinician that you're going to be nursing with. You get to know the software, you get to meet the practice managers and get to know how Rodericks Dental Partners operate. So studying for your ORE at the same time, you'll be earning money at the same time. And then you potentially have, you're in a position where we can then find you a place as a mentee dentist in one of our practices. So it's a win for all, really. And Gemma will probably want to add something to that.
Yes, please.
Yeah, no, I think it's great. Look, I know that a lot of international dentists don't necessarily want to come and work as a nurse. You're qualified as a dentist, sometimes it does feel like a bit of a step back. But actually, it's such a great opportunity, like Puja said, to learn and watch a dentist. You're technically shadowing a dentist while being paid for it. So you're learning the ways of working within the UK, their communication to patients. It's obviously great to pick up on. Obviously as well, it allows anyone who needs a visa to come and work in the UK. We can offer sponsorship for that as well.
Amazing.
So it's just another path, to help support people come across as well. I know from experience that some people have struggled to sit the ORE Part 2 because they book the exam and then don't get a visa in time. So it's really good that, they'll already be in the UK and obviously can then focus on that, on the ORE elements off the back of it. And it's great from our perspective as well because, we can really see people go through that journey from that nursing. Obviously, if they were lucky enough to get their hygienist therapist registration in before that closed, go through that phase and obviously go on to be a dentist with us as well, which is great.
Amazing stuff. I mean, that is. I'm sure the more that people catch wind of this, there'll be so many people at your door for this because it is such a great opportunity, and I think people will take advantage of it. And that kind of brings me on to my next point quite nicely. Actually, we don't really credit the rest of the dental team, right? Usually, a lot of people are just focused on dentistry, be a dentist, and that's the be all and end all of it. What else do you guys work with, or who else do you work with outside of just dentists? Do you deal with nurses, receptionists, the rest of the dental team, or is it very much just a case of dentists and that's all?
Yeah, so myself and Puja just look after dentists. We do have other teams within the recruitment team that look after more of our, say, employed roles. So they look after our practice managers, our nurses, TCOs, all of that, obviously, to generate that support mechanism within a practice, really.
Perfect. I think it's good to know that, there is more to a dental clinic than just a dentist. So
definitely.
So they specialise in it.
Yeah, exactly that. And then in terms of like career development, so this is something that a lot of aspiring dentists and newly qualifieds are always considering, and they usually don't have much guidance when it comes to this. What would the Rodericks sort of partners, what would they like to do in terms of career development, and what's the long-term plan with people? I think a lot of individuals might be seeing this as maybe just a stepping stone into dentistry and then I'm done with Rodericks, right? But obviously we want to build a bit more than that here and understand, what do Rodericks allow for that future planning, that career development, and how can this become more of a long-term relationship?
Yeah, for sure. We obviously want Rodericks, and Rodericks is a number one for clinicians, and we encourage and provide the facilities to help clinicians grow. So we have an excellent CPD program, and that is offered from obviously your foundation year training. We have a vast array of speakers. We hold webinars. We are affiliated, obviously, with some big providers. You can enroll on a certificate program, a diploma, a master's, and obviously all of that development you're going to bring back into practice. As I mentioned earlier, if there is a course that you want to take on board, then we provide co-funding. And we have had a lot of dentists join up and take advantage of that, really.
Great stuff. And just to kind of like, before we kind of wrap it up, what's the future look like for Rodericks? Where are you aiming to go with the group as a whole? And then on a personal note, are you thinking about doing anything in Kent? Because that's where I'm from. So I need something around that area. And I also get a lot of questions about Scotland. So what's the future look like? Anything on Kent, anything on Scotland?
I think that's hard for us to answer. Yeah, I would love to get more and more practices down in Kent, London. That would make, obviously, from a recruitment perspective, that would make our lives like incredible. But it just depends. Obviously, we have a whole acquisitions team that look at practices, and we're not here, I guess, now in a situation to just sit and buy every single practice or anything like that. Yeah. We obviously want to buy really good, quality practices now that are obviously going to benefit us, but also obviously clinicians, obviously within the future as well. Obviously the plan is growth, so who knows? We could be in Scotland. Who knows?
Yeah, I think the future is really positive. And, if you're interested, and even if you just want information, just reach out to us, and, one of the team members will contact you. And, just from a personal experience, I've grown so much as a clinician, and I wouldn't have had these opportunities unless Rodericks Dental Partners, they're very good at spotting talent. They are very encouraging, supportive. Our practices are the facilities, the teams. Like I said earlier, the collaboration is really good with all the teams.
That's amazing stuff. And honestly, I think the audience that are listening, they are definitely going to be very excited about the news that you provided today. And you've done it in such a concise way. So I really do actually appreciate that, because all of the questions that I had around how to get started, how to get in touch, whether you guys assist those from overseas, the nursing route, the geography of things, how the contract's set up and what that typically looks like. Literally, we've done that within half an hour, which is mind-blowing. So I think anybody listening to this probably got a notepad out, because there's so much information in this. If you've got to go back and listen to it again, it's well worth it. And from me, I'd like to just say, definitely reach out to these people. They are, all of them, every single person I've spoken to from Rodericks, so anybody that I've interacted with that's dealt with Rodericks, has never said a bad word. It's insane how well that you guys recruit within yourselves, because there's never a bad seed, I think. So there's many other corporates out there and many other big groups out there that just don't really, I think, have that personal touch. And I'd say more power to you guys. Keep on with that more family approach, let's call it, because it is actually, making waves in the industry. And I think a lot of people are going to be heading in your direction, including myself, post-graduation. I can't wait for that day. So I just wanted to say, from myself personally speaking, and from everybody else listening, to Gemma and to Puja, thank you so much for joining today. If you've got any parting words before we close it off, guys, feel free. The floor is yours.
No, thank you for having us. It's a real pleasure. And please reach out, and we look forward to having you on board. And thank you for having us. And good luck with your studies. See you in the future.
See you soon indeed. Yeah, no, thank you very much, guys. And once again, everyone, thanks for tuning in. I'll see you on the next one. Take care. Bye-bye.
Bye.